Hello, this is Halim, and I'm the Crisis Communications Officer for WHO Regional Office for Africa, and I'm working on setting up and coordinating the Africa Infodemic Response Alliance. Today, I'm going to take you through how WHO in Africa is working on infodemic response management. And to start, I would like to say that through the work and the consultations that the EpiWin team and WHO Geneva has been working on, WHO has managed to get more than 1,300 experts to come up and agree on a framework to respond to infodemics. And as you all know, infodemics cannot be eliminated, but they can be definitely managed. And there is no one discipline and there is no one organization that could actually handle the threat of misinformation on its own. That's why we, according to this consultation and according to the work that we have been doing, it's quite important. We realize that it's quite important to have collaboration to address this very complicated and multifaceted problem. So I'm going to share my screen with you and introduce to you the Africa Infodemic Response Alliance and the work that we are doing here at the regional level in Africa. So we have been working, the clear objective here is to limit the spread of misinformation. So WHO Afro led a collaboration between operational agencies and fact-checking organizations to respond to health misinformation. We've created a kind of unified branding to make sure that we're all represented clearly, despite having a clutter of logos. So as I said, the Alliance hopes to manage the infodemic, and we would like to do that through early detection. So we would like to make sure that we have a monitoring system that allows us to capture misinformation and information gaps as early as possible, as well as working, and that would happen both online and offline, not just online. And we would like to coordinate the efforts that we're doing because different agencies and ministries of health are working on different aspects to respond to different parts of the infodemic. So far we have about 6 engaged partners that include, in addition to so in total, the partnership or the alliance includes WHO and 10 organizations and the Verified Initiative. So that includes UN Global Pulse, UNICEF, Africa CDC, US CDC, and the IFRC, and of course the Verified Initiative. And when it comes to the fact-checking organizations, we're working with the fact-checking organizations that are members of the International Fact-Checking Network. And these are the biggest organizations in sub-Saharan Africa. That includes Africa Check, AFP Fact Check, PESA Check, Dubawa. And we are working with Medan, which is an organization that's providing us with a platform that's called Check that enables us to aggregate and the flagged misinformation in one place from social media. So as I mentioned earlier in my presentation, there is this infodemic management framework that WHO and more than 1,300 experts from different disciplines has come up with to organize the kind of response to infodemics. And there are 4 main pillars that we are trying to implement here with this alliance. So there's identify, which is identifying the misinformation and the information gaps. Simplify is to simplify the technical information and break it down to something easy and digestible, as well as debunking the misinformation and clarifying any misconception. And then there is the amplify, which is disseminating it through the targeted channels. And then finally, we have quantify, which is trying to measure the reach and engagement, as well as the impact on the social behavior. So these are the different tenets, and through the work of the different members of the Alliance, we can see that there are so many different initiatives that are being done that we can map through here in this, under these different pillars. So the alliance that we're working on is currently focusing on two things. We're focusing definitely on the narrative around COVID-19. That includes everything about COVID-19. And we're focusing on the introduction of the COVAX, or the COVID vaccine. The second thing that we're focusing on is the narrative around the polio program and the introduction of the new polio vaccine, which is called the novel oral polio vaccine type 2. And that's significantly important because it's the first use or initial use countries will be in the region. The alliance, we have identified five main pillars or areas of work. We have identified them based on the discussions with the different partners. And the key important thing for the alliance is definitely to coordinate. So coordination and harmonizing the different efforts that the different organizations are doing to avoid duplication, to make sure that we're connecting the dots and all of that. And that also goes on in terms of funding. So one thing that we're hoping to do as well is to make sure that our alliance can easily form a consortium, and we can apply for grants, all of that. There's also the infodemiology research. So there's a lot of research questions that are still understudied when it comes to misinformation and health misinformation, how to respond to it and all. So the alliance we would like to set an agenda, a research agenda, based on the kind of practices that we're doing and the different interventions that we're doing to try as much as possible to capture different elements and analyze them and understand the impact of them when it comes to the interventions, as well as advocacy. So for sure, we need to work on making infodemic management and responding to health misinformation come on top of the list when it comes to political priorities for both the emergency operation centers, the ministries of health, and political leadership. And the fourth pillar of or area of work is country support. So basically, we would like to provide detailed, tailored country support based on the needs and capacities and in each country. So that's something that we would like to provide, and I will elaborate a little bit on that here. And the final thing is viral facts, and that's an initiative that we would like to launch, and it would be a public-facing brand that represents the work of the partnership and the alliance, and we'll also elaborate on that. So in terms of country support, we have identified like very broad strokes, summarizing what would the kind of country support that the alliance would provide would look like. So basically, the first thing would be conducting a landscape analysis, understanding who's doing what, who are the different actors and all of this, and then developing an infodemic management strategy, which would be through understanding the needs and the different interventions based on the context, and how can we set up and develop a strategy to deal with that based on the different kind of infodemic management, the pillars of the infodemic management framework. And then we would like to develop in-country capacity. So that's not just through the Ministry of Health, but also through the UNICEF, WHO, and civil society organizations in the country. And then we would like to recruit and deploy infodemic response managers. And through the infodemic managers training, we would have an entire cohort with about 66 professionals from the African continent that would be available to deploy and trained on infodemic management. We also would like to have this infodemic response manager to lead on the implementation of the interventions. Finally, and the most important thing, and that's the critical thing about infodemiology or infodemic response, that's measuring the impact of the interventions. So we would like to make sure that we can quantify the impact that we're doing, And that we are looking into, of course, if we're talking about social media or media management and all of that, we're looking at the reach and engage with the different messages, and also about using the community feedback loops and surveys and working and focus groups to understand the impact of these messaging on social behavior. One of the important things that we've done in the coordination of the Alliance is to try and map out the existing initiatives that we have under the different areas of work that we are doing, to try and harmonize the different agencies and who's doing what, to try and get a sense about it. We're hoping to launch the Alliance on November 26th, and hopefully we are looking into launching Viral Facts, which is the final area of work, on by the end of January. So Viral Facts is a social media response to the infodemic. A lot of misinformation is circulating on social media and on digital media. So one of the things that we would like to do is to ensure that we address this sort of misinformation. So here on the side, you can see one example of a viral fact video that we have developed, and it was about addressing misinformation around the oral polio vaccine after the certification of the African region free of wild polio. So there was some misinformation around the oral polio vaccine because people got confused if the polio vaccine had caused the circulating vaccine-derived polioviruses and all of that. So through this video, we tried and highlighted the reason why this is inaccurate and what is actually the correct information. So we would like to, through Viral Facts, so first of all, let me tell you, why did we create a new brand? Because that must be a question on everybody's mind. I mean, we have UNICEF, WHO, and other agencies that are very well reputed, but we wanted to have a new brand to make sure that, because each of these agencies have a tone of voice on its own as an organization and as an institution. Debunking misinformation and addressing misinformation is not something that is kind of agreed on or something that comes out from the organizations, these agencies. But on the other hand, one of the things that we would like to highlight is that we can have all of these different organizations compiled in one brand, as well as on top of it, the fact-checking organizations, and to have a joint brand, to be liberated from these kind of institutional limitations on social media posting, and to ensure that all the members of the Alliance and the partners would have would own the material and own the content and feel some sort of encouragement to share it across its different platforms. The content for Viral Facts is simple. We've identified three main kind of themes to develop content for Viral Facts. So there is Explained, where we do explain our videos that break down complicated issues around public health issues. So for example, one explainer, what is the COVAX facility? How does it work? How many vaccine candidates do we have? And all of that. Debunked, which would be explaining, correcting viral misinformation circulating online and in communities. And that's through something that we call the feedback sandwich, where we try to state the correct information and then highlight the misinformation and explain why it is wrong and what is the correction, what is all of that. That's a very important piece, and there's very little research around the effectiveness of at what moment does the does the person who's consuming the debunk would change their mind, and how effective are they, and how viral do they go? There's a lot of best practices. There's a lot of work that has been done on that front. But I think on a health, in terms of health, misinformation and debunks, there's a lot of space to do a lot more research and testing on that front. And then there is Get It Right. Get It Right will be a misinformation literacy campaign. So we would get certain pieces of misinformation and analyze, why is this wrong? How can we improve the content here, and how can we change it? So all of that, that's something that we can definitely highlight. Dissemination channels for viral facts, we're prioritizing Facebook, Instagram, Twitter, and of course, cross-posting with fact-checking and media collaborating organizations. And most importantly, WhatsApp. So with WhatsApp, we would like to make sure that we can reach the communities through WhatsApp, because WhatsApp is a great source of misinformation. It's quite important to highlight these different channels and try to correct information through the same channel. And that's something that's quite important. So because it's a closed communications channel, we would like to push the correct information through different groups and community leaders and partners and all of that. And it's important to highlight that the kind of development of the content that we have needs to be quite fast to make sure that we provide the information, the correct information, in a timely manner, and we try to get an understanding of the different trends and how can we respond to it. So for example, with Identify, we can take for example, social media monitoring. We monitor the discourse around COVID-19, and we pick, for example, that in one country there is a confusion around, say, or rumors saying that Africans don't get affected by the COVID-19 virus, and then we need to develop materials that are there. And that's to the right here. You can see once we pick it up here, we have developed a number of templates that we can use to quickly produce content to respond to that misinformation. And it's important to highlight that one of the things that we really focus on before launching is to make sure that we have a lot of testing, and we try as much as possible to know if these templates work or not. People, do they share them or not, and all of that. As you can see here, we can have a lot of, we can have these templates in different formats, and for video on Facebook, Instagram, we can do the carousel. We've also designed some templates for WhatsApp. So these are simple GIFs that we can use for WhatsApp, and we can do health quizzes for Instagram, etc. Again, more static kind of content for WhatsApp. And it's quite important to highlight that the localization and the possibility to change the language and to make it more tailored for the content for translations in local languages, English, French, or Portuguese, etc. Here, we have developed a little bit of a matrix. It's very conceptual in a sense, where we are trying to, again, highlight what would be the impact of viral facts. And here we can see the reach, the engagement, the effect on the reach and the engagement and on the behavior, and how can we, where do we understand the different elements and the impact on each thing in terms of content production. So that's it, and viral facts, and that's it regarding my presentation. I'm very thankful for your attention. And if you would like to have continue the conversation, please feel free to reach out to me. I would be very happy to support. If you're in the African region and you would like to have a chat about infodemic management in your country, please feel free to reach out. And if you are from outside, and if you have from outside the region, and if you'd like to also use a sparring partner, or if you're interested in setting up a similar alliance, please let me know, and I would be happy to chat to you about it. And if you have any questions about what I've said, please don't hesitate to get in touch. It was very nice speaking to you all, and hope to see you soon.